Dr. B, you get a lot of referrals when someone has lumps on the arms, on the neck, from a pediatrician. Why is that?
Well, those lumps are something called lymph nodes, and those are a component of the immune system of the human. Those get swollen often, and in kids in particular, during the first 5 years of life, it is extremely common for lymph nodes to be larger than expected, and that's because they're doing their job. The lymph nodes we're talking about and their concern generally are in the neck area or sometimes in the groin area. And if you think about it, our mouth, our nose are one port to the world, and the genital area is another area where we're open to the world. So it certainly makes sense that the immune system has its fortification somewhere around that area, those areas actually.
The doctor before referring to did a couple of things. He got a chest x-ray, he got a blood count, and had to get on antibiotics for 10 days. Why did he do that?
Well, generally what you want to, since there are two things that you want to make sure. One is that this lymph nodes, these swollen lymph nodes, are not predicting or are not part of a more serious problem, i.e. leukemia or lymphoma, malignancies essentially.
So if he gave an antibiotic and the lymph nodes got dramatically reduced in size, that would be a good sign.
Right. That's generally an extremely good sign that the problem is infectious, and that the antibiotics have taken care of the infection, and therefore most likely there is no need to do anything further other than let the problem.
Well, why would a doctor do a chest x-ray when my lump is in my neck?
Well, the lump in the neck is visible, but there are lymph nodes and other organs that belong to the lymphatic system that could be affected by, for instance, a cancer that are hidden deep in the chest. And and so the only way to check for that is with a simple chest x-ray to see whether or not there is a big lump, for instance, in the central area of the chest, which would suggest a more serious problem than just an infected lymph node in the neck.
But a negative chest x-ray doesn't exclude the possibility, it reduces the possibility.
It reduces the possibility, yes. Because, for instance, a number of cancer of the lymph nodes may just simply be present in the lymph nodes that are felt, but not deep inside. But as that becomes the beginning, if you will, of what is necessary when somebody has cancer, where we need to know the extent of the cancer and where it is, because what we call staging, that essentially is the amount of cancer that people have and where it is generally important in defining the treatment.
And if you weren't sure it was good or bad, what would usually be done?
Well, the next step there is to actually do what is called a biopsy, which means that we would ask generally a surgeon to take this mass out and give it to the pathologist, because then we would generally be able to have the so-called definitive diagnosis. We would know for sure whether or not it is cancer or not.